Before we start this session on eating disorders, how common is it in Sweden?
Well, today we have around 100,000 people who is diagnosed by eating disorder. That is just like a small amount of people who actually have it, but because we have around 900,000 people having an eating disorder, but we can only see the people who is diagnosed.
You said it was 100,000 dying. Don't tell me that it is annually.
What did you say?
Don't tell me that it is per year.
No, it's not per year.
Thank you.
I think that we are actually seeing it from every other year, so it's in a 2 years perspective.
Okay.
But it's the diagnosed people, so we can't really see the actual number of it.
Okay, so this is a real big issue in the society.
It's a real big issue, yeah. It is.
Thank you for being here today. We're so thrilled to take part of your presentation.
Yeah,
Stage is yours.
I bet you can't see my scars. In fact, they are not visible, but they are deep and they still hurt. What I'm talking about here is my eating disorder that took away a big part of my youth. And the help that I got from the Swedish healthcare was so focused on food and calories, something that I already knew everything about. I was 15 years old when I developed an eating disorder, and it did not just affect me, but me and my whole family's lives. I have spent many years together with different psychologists at hospitals, trying different kind of methods. I've been at the daily care for anorexia, and it gave me a lot of experience of how the Swedish healthcare actually work with these kind of problems. My parents and my family, they had no understanding for what I went through, and the healthcare was just focused on making me gain weight and not actually how I was supposed to feel better from the inside. Progress Me wants to change the awful number of people having eating disorders today and contribute with simplified tools for good help. Today we are working with free tools for patients, but also tools to help and support families and friends to give them more knowledge about the subject and manage the situation. We've seen that the willingness to pay for help is high among this target group, and families are able to get access to this by paying subscription fee once a month. The revenue will be used to create more further developing. By working with strength and self-esteem and self-confidence, we are not only helping people who have an eating disorder, but we also reduce the risk of develop one. Everything we focus on is evidence-based and built on cognitive behavioral therapy. So why do we work with self-esteem when it comes to someone with an eating disorder? Why are we not focusing on food and weight? Well, studies prove that people with better self-esteem tend to suffer from eating disorders to a lesser degree. This is because low self-esteem also leads to consequences such as poor attendance in school, extreme individual need for control, other forms of mental illness, severe health problems, and sometimes even death. I am also sure that some of the people who are sitting in this room got bullied in school, felt a little bit different from the other people in the class, that someone was very early in the puberty and felt ashamed of their body, or someone who was a little bit bigger than the other people in the school. To feel like this as a 10-year-old is a shame. You blame yourself, you hate yourself, you even change as a person, become more lonely, introvert, sad, and angry. Schools in Sweden have started measuring stomach circumference, and researchers hope that all schools will follow. Can we read that again? Schools in Sweden have started measuring stomach circumference. I really can't see the positive thing here. First of all, we are living in a society where kids are sitting with smartphones, video games and iPads all day long, eating snacks, drinking Coke. The first solution here would be more activity, and that is also something you as a parent can change and help with. In other cases where the kid actually doesn't feel good, and the reason of the weight gaining is because of self-hate, low self-esteem, bullying, or something else, this would be a punch in the face. To feel even more different than before, in worst case scenario, this will lead to mental illness and eating disorders later on in life. We are focusing on the individual, and to start work with young people's mental health would be a good thing to start with in schools. It's also important that daily activity is something both teachers and parents start to focusing more on. Not just because of weight, but because of well-being. With our mobile app, young people can learn how to train up their mental health and their self-image just by doing small tasks every day and getting challenges. And in the long term, this will have a positive effect in many ways. We are living in 2019, and we are still using methods we used 100 years ago. BMI was developed in the 19th by a statistician, not a physician. It was designed for populations, not the individuals. And most important of all, it ignores behaviors. We need to challenge old methods, and we have to start focusing more on prevention. My name is Petronella Gustavsson, and I am happy that you were listening to me. Thank you so much.
You nailed it.
Yeah.
I think that all of us understand the importance of embracing new tools as to get a greater impact on the work we do.
And it was very interesting to listen to the speaker before, who were talking about the VR for anorexia. It's something that is completely new for me as well, so very interesting. Then I learned something new as well.
Good. So, at the start of this session, you mentioned 100,000 patients with a diagnosis, and then almost 1 million people that are connected or provoked by eating disorders. How come that there's such a huge gap between these two figures?
It's like I have been talking to a lot of different psychologists and also the primary healthcare, such as vårdcentraler. And the problem here is that it's so many people who are coming with the same problems that it's so hard for people to actually see, is this an eating disorder, or is this just something that this person is going through in school or in life? So then after they are going through this, like you weight the person, you're going through the BMI, and then you see, no, you are not in the scale for an eating disorder, so we have to send you home. What happens with the person who actually has the mindset of an eating disorder is that the person is going home and thinking, they told me that I was fat, so I have to lose more weight. And then they're coming back to the primary healthcare again after some months, and then it's too late, and then they have to go to the specialist healthcare. So we at Progress Me, we want to be the bridge between the primary healthcare and the specialist healthcare.
Super. So when we meet you again, if not before, but at the next Park Annual in a year, where will Progress Me be then?
Actually, now we are working to build a system where we are helping both the healthcare providers and the individual and the parents in the same system. So we will have a prototype done in Q4 2020.
Super. Many thanks for
Thank you so
being
much.
Here. And both you and Almira will have a donation to save the rainforest for your good work here today.
Thank you so much.
Big hand of applause.
Thank you.